Well, let's continue the conversation around this, and we're joined now by South African clinical infectious diseases epidemiologist, Professor Salim Abdool Karim, who joins us from Durban this evening. Professor, good evening to you. And for purposes of this conversation, my understanding is that you are the special advisor to Dr. Ghebreyesus, and we are thankful for your time. Let's understand the origins of the WHO and the centrality of the United States in its formation back in 1948. Take us back very briefly as to how important the United States was at the establishment of this organization.
Good evening, Tolly, and good evening to all of the viewers. There is no question that at a global level, the World Health Organization plays a central role in healthcare in many different ways. Just take one simple example. If you look at, for example, the standard of treatment for pneumonia or for HIV or for tuberculosis, the evidence for that is gathered by the World Health Organization. They bring together all the different countries, and then they set up and create the treatment guidelines so that you can have a disease and be treated in a standardized way on the best evidence across the world using the World Health Organization guidelines. And that formulation is now in existence for over 75 years. And at its origins, the US played a central role in creating this body, creating it because the US, like all the other countries in the world, recognized that health and infectious diseases and health problems do not follow country boundaries. There are many challenges we face at an international level, and nowhere was that more clear than in COVID-19, where when you saw a problem in one country, it became a global challenge very rapidly.
Yeah, and you invoke COVID-19. It is that very pandemic that has brought about this action by President Trump, because this is an action, by the way, that he had started before he left the Oval Office back in 2021. You talk to us, Professor, about what your response is as the WHO when he says that the WHO mishandled COVID-19, and add to that, he is upset about what he says is the biased relationship that China seemed to enjoy from the WHO. Is he correct?
Not correct. And in fact, the two reasons he has put forward for withdrawing from the WHO was in his first term as president, he argued that the World Health Organization was biased towards China. And that's simply not true. China, like every other country, is a participant in World Health Organization activities. It has no special status. And in fact, overall, there are more individuals from the US who participate in World Health Organization activities than China. So his claim that there's some special relationship with China is simply not true.
Yeah.
In his second term, he now claims that the US has a disproportionate contribution to the World Health Organization's budget. He refers to it as the US is being burdened by having to pay this money for the World Health Organization. And that's, again, simply not true. The US is the country with the largest per capita GDP, but it contributes less than a fifth of the World Health Organization budget. So proportionately, it actually contributes less than it should. So there's no question that both of the reasons being given are not true. But those stem from a period where the World Health Organization was trying to provide evidence and information to help in the response to COVID-19. And at that time, many countries and many presidents, and one of them being in the US, didn't choose to follow that evidence. They did not support, for example, the use of masks as one example, support for vaccinations. So what we're seeing is a backlash from that period.
Yeah. We'll talk, Professor, in a moment about the funding implications of this withdrawal, if indeed it does come to pass. Let's focus the attention on China for just a moment, because the assumption here is that President Trump is peeved by what China did at the time that WHO officials sought access, and I think specifically in Wuhan, where the pandemic began, and they were seeking access, these officials of the WHO in Wuhan, because they wanted to understand whether indeed this were the origins and what could have prompted this. Nonetheless, the understanding, and you'll correct me here if I'm wrong, there was never access granted by the Chinese authorities. Is it not going to be justified, again, to say you are lenient on China, unnecessarily so, when a virus that ultimately affected the entire world did so without those accounting where this thing is understood to have originated?
Yeah, so there are many different theories about where SARS-CoV-2 originated. But when we look at the evidence, and there are now several studies that point to this, that the bulk of the evidence suggests that it was a natural spillover and came from bats into an intermediate host. It spread largely through the Wuhan seafood market, and it then spread into the population. This notion that the Chinese Institute in Wuhan or the Chinese government made this virus and spread it around in its own people in the hope that it would spread to the rest of the world is simply not true. I mean, there's no basis for that. It's just fanciful thinking. And what has happened is that in the US, it has become a politically partisan issue. It has become the basis on which the Republican Party has chosen to go after certain scientists. And there's circumstantial evidence that you can conjure up and claim that that's evidence that the Chinese actually made this virus, or they spread this virus, or that it was made in this institute. There is no evidence for that. It is just people's hypothesis or their theories. So let's look at what we're facing, and that is that we were facing a situation of cases very early on. The World Health Organization sent a team to go and investigate those cases, and they took samples and so on. They investigated the whole thing. They were not given access to the Wuhan Institute of Virology. That, in my opinion, was a failing of the Chinese government. It was a failing on their part to be transparent. And because they were not transparent, they created the basis on which all of these fanciful theories have thrived. And I think that was a mistake on the part of the Chinese government. They should have been transparent, like we have been transparent. When our scientists discovered the Omicron variant, we told the whole world about it the next day. We didn't hide it. We didn't have anything to hide. So I think that governments have made mistakes. Chinese government has made mistakes. The US government has made mistakes. Our own government has made mistakes. So that's not the basis on which you pull out of the World Health Organization.
Yeah.
The World Health Organization is our first line of defense when the next pandemic comes. And there is a next pandemic. It's coming. We just don't know when and what's going to cause it. And we need a strong World Health Organization to be at the front lines to deal with it.
Yeah. Final question to you, Professor. And we now talk about the implications of funding for the WHO. The US, you've already said that proportionally, they actually not paying as much as they should be paying. But they do indeed provide the WHO with the biggest pool of funds. And so carrying out this executive action at the very start of the administration, the Trump administration, the fear here is that the likelihood is that the US will indeed eventually leave this global organization. How badly affected are your finances going to be as the WHO?
The US currently is not among the top 3 contributors to the World Health Organization. When President Trump took office the first time around, it was the single biggest donor to the World Health Organization. But progressively, due to his actions and subsequently, the US contribution has steadily dwindled to the point now where it is a much smaller contributor. But it still contributes around just over $100 million. And the WHO budget is going to have that shortfall in the next cycle. But it's now incumbent upon philanthropies and other governments to start helping the World Health Organization fill that gap. And it's an important gap to fill because what we don't want a weakened WHO. We need it to have the capacity to respond. And in terms of the overall budget, I think the WHO will go through a prioritization exercise to look at what of its activities it can afford to put on a lower budget or to put on hold until its finances are recouped. But I think we'll see what happened the last time, which is Scandinavian countries and other countries around the world came to the party and supported the World Health Organization and made up the shortfall. And I hope our country, amongst others, can make a small contribution because every cent counts.
Yeah. Is there a way, Professor Karim, that this decision by President Trump can be reversed? Are there efforts being made as we speak to try and convince him otherwise? Or is this a final decision?
I think the US government, when it makes decisions, it's a pretty hard process to unravel, but it can be undone by the legislature. The legislature can reverse those decisions. The problem is that the legislature is also in the hands of Republicans now. So the prospect of that happening is very small. I think as an executive order, the World Health Organization and everyone else have taken this for granted, that this is the status quo. It actually is going to affect the US much more than it's going to affect the WHO, because it now means that the US is saying to the world and to the WHO that it is no longer going to play a leadership role in global health. It's saying, actually, we don't care about the global health anymore. That's yours. You take care of it. We are going to focus only on health in the US. And I think that that's really short-sighted of the US. And it's going to find that this decision is going to impact on itself as much as it impacts anyone else.
Professor Salim Abdool Karim, thank you very much for your time talking to us in his capacity as special advisor to the head of the WHO.